Hey guys, now have you ever disagreed with your doctor, but you were afraid to say no, or you just didn't know how to say no? Well, in today's video, we're going to dive into the topic that you have the right to say no, and we're going to talk about just how you do that. So, as a cancer patient, as a newly diagnosed cancer survivor, there are a lot of decisions that have to be made, and there's a lot of new information that you're receiving. And sometimes you don't feel good about the recommendation that's being made and you really want to say no. And first of all, I want to tell you that you have the right to say no. Because doctors don't make decisions for you. They make recommendations based on the data that they've learned over time, what they've observed from other patients, and what the literature and the clinical trials tell them is best standard of care for you based on your scenario. But all of that being said, you definitely have the right to say no because it is your body. But there are 5 things that I want you to consider before you say no. So the first thing that you should consider before you say no, if you're considering saying no to a recommendation that your doctor has made, is, are you making an informed decision? Because every decision that you make about your health care should be an informed decision. Do you understand what your diagnosis is? What the staging is? Do you completely understand your condition? Do you understand all of the different treatment options available to you? Are you aware of all of the side effects? Make sure that you're asking the questions to get all of that information so that you're making an informed decision. Sometimes you're given all of that information, but you may not understand what's being said because as medical professionals, sometimes we talk over your head. We assume because we are in it day in and day out that things that are common to us are also common to you. And unless you ask for clarification, we will carry on an entire conversation that may be over your head that you don't understand. So it's important that if there's something that you don't understand, that you ask those questions and get clarification. Sometimes the person that you're working with is not the person that should be working with you. They may not have the right bedside manner for you, or they just may not be someone that you take to. And that's an opportunity to get a second opinion. That gives you not only an opportunity to be introduced to another personality, someone with a different bedside manner that you may gel with better, but it also gives you an opportunity to get the information from another person in a way that may be different and in a way that you're better able to understand and comprehend what's going on. So before you say no, make sure that you're making an informed decision based on all of those characteristics. Now, the second thing that I want you to consider is, have you been heard? Now, are the recommendations that are being made based on the information that you gave them in regards to what your preferences are? Does the physician know your preferences? Do they know your schedule and the things that you have planned that you're trying to work around? Make sure that he's hearing all of those information and make sure that he's hearing your concern, because sometimes we want to say no to a recommendation that's being made because they did not understand your concern properly. So make sure that everybody's on the same page, because many times a lot of assumptions are being made. We assume that someone knows what we mean when they don't. You may assume that the doctor knows something because you told the nurse, but that nurse may not have communicated that information to the doctor. So make sure that no one is working off of any assumptions, that you're not assuming the doctor knows something that he doesn't. And also make sure that the doctor isn't assuming something about your situation that you have not said. So make sure that the communication is clear and open before you say no. Third thing that you want to consider before saying no is you want to make sure that you're separating, is a decision based on facts or is it based on fear? Because when we look at what fear is a belief, a perceived reality based on the anticipation of something bad happening. So it's not fact. So you want to make sure that whatever decision that you're making is based on facts, not fear. And that goes back to really understanding all of the implications around that treatment recommendation that's being made, knowing all of the side effects, knowing what's all involved, how many office visits there are, how long you're going to be in the office, the side effects, how you're going to be able to function after that treatment is given. Make sure you're considering all of that to make sure that that decision you're making is based on facts and not fear. So the fourth thing that you want to consider is you're going to want to make sure that you have support in making this decision. Cancer is an emotional state, and you want to make sure that you're not making a decision based on your emotions, because sometimes our emotions deceive us and it makes us fall back into that fear-based decision-making circle. So we want to make sure that we have support when we're making decisions like this regarding our care. Always take a second set of ears with you to the doctor's office so that that person is hearing what you're hearing or not hearing, and seeing or even asking the questions that you're not asking. If you're not physically able to take that person with you to the doctor, make sure that maybe you call that person, have them on FaceTime, have them on video, or even on speaker so that they can listen to the visit and ask questions and be of some assistance to you as you're getting all of this information before you make that decision. So make sure that you seek support as you're making decision. And after you've considered those four things, if the answer is no, make it a firm no. You don't have to do a whole lot of explanations around why you're saying no. But sometimes, you just feel it, that the answer is a no. You don't feel good about that decision. And sometimes it's a no, not right now. But it may not be a no. It may be a no until you get more information, or a no. But don't let yourself be pressured into doing something that you don't feel good about, that you haven't gotten yourself to a point where you don't feel good about that decision. There are alternative therapies for many types of cancer treatments. And you can always, again, get a second opinion that may honestly be different than the original opinion. So, but when you get to the point where you've exhausted all of the things that you should consider and your answer is no, be okay with your no and be firm with your no, and let your physician know that. And it's okay if you say no and then later you change your mind and you want to move forward. At that point, it's just a phone call, getting back into the office and going ahead and getting treatment started. Don't feel like if you said no, that it's a no forever and then that you can't change your mind. You can always change your mind, because this is your body and all of these treatment recommendations are your decision to make in the end. So hopefully this was helpful for you. If so, please like this video, please subscribe to this channel, and I will be back tomorrow with another video for you.